Hi everyone, today we're going to propose the idea of a bronchial implant. My name is Emily and my teammates are Desiree, Marissa, and Mia. So imagine having to gasp for air every time you took a breath. That is what it feels like to have chronic obstructive pulmonary disease or COPD. COPD is the combination of lung diseases like emphysema and bronchitis that causes airflow limitation. It causes narrowing of the airways and causes the bronchial tubes to fill with mucus, blocking airflow to and from the lungs. COPD affects more than 15 million Americans and causes 150,000 deaths each year. The total life expectancy loss for a person diagnosed with severe COPD is approximately 8 to 9 years. Having a COPD is also very expensive between hospital bills and treatments. According to one study done in Sweden, the annual cost for severe COPD patients is over 17,000 euros. Furthermore, there is no cure. With that said, there are treatments. For example, a lung transplant that can help to prolong these patients' lives. However, the average waiting time for a lung transplant can be up to 2 years. Therefore, there's a need for an artificial bronchial implant that can help COPD patients live longer and more comfortably with their disease by allowing increased airflow to and from the lungs.
Our approach to this problem is a bronchial implant designed to open up the patient's major airways and release lipase to target the mucus produced in the lungs and prevent it from accumulating and impeding breathing. Here's a more detailed schematic of our proposal. The implant would be inserted by a surgeon during a bronchoscopy into one or more of the patient's primary bronchi, the major branches of the lungs' airways. The implant would then expand to open up a COPD patient's airway by around 75%. This is accomplished through the implant's metal lattice made of nitinol, contained within the polymer lining. This expands to the walls of the bronchi, opening up the airway and keeping the implant in place and open. Then small laser-drilled holes in the polymer would further promote air exchange, as well as combat the excess mucus produced by COPD patients' lungs by releasing the enzyme lipase over a period of time in order to break up the mucus.
One big benefit to our implant is that it eliminates the need for a patient to remember to take their medication. It would also resist airway compression, relieve chest pain, improve airflow, and help decrease mucus buildup. In addition, it would be a safer alternative to a full lung transplant. For comparative purposes, we looked at airway stent statistics. Financially speaking, it was about a quarter or less the price of a single lung transplant. We also found that the survival rate for air stents was rather high. In 1 year, the survival rate was around 92%, and in 5 years, it was around 70%. Some risks include the invasive nature of the treatment, which could pose fatal risk in the event of a failure. It could also need replacement, depending on the length of the long-term delivery system. It would require a lot of testing due to its invasive nature and have a much more difficult FDA pathway. But we still believe that this product is worth exploring.
COPD and resulting bronchitis and emphysema can be treated in several ways. These treatments aim to alleviate symptoms, slow down disease progression, and increase physical endurance. Two major treatments include pharmaceutical therapies with anti-inflammatory effects and breathing exercises. These exercises aim to rid the lungs of stale air, which is difficult for people with COPD to do naturally. These treatments help alleviate symptoms, but do not correct the underlying issue itself. One treatment previously mentioned that targets the cause of COPD is performing a lung transplant. A lung transplant can prolong a patient's life and increase their quality of life. However, the waiting time is long and there can be adverse reactions such as rejection or infection. We are focusing on these limitations to develop a device that corrects the problem and prevents continued mucus buildup. These are our references. Thank you for listening.